Beautiful Ethicuties and the 40% of you who have still not subscribed to the Ethicsverse, welcome to the coolest place to be every Tuesday at noon Eastern. If you think changing our healthcare workplaces is going to change our world, I'm coming at you live and direct from cloudy Miami at the spooky haunted Biltmore Hotel in Coral Gables. We got a real treat for you. Let's get a massive emoji explosion for the one and only Mary Inman. How's it going, Mary?
It is great. I'm so happy to be here, everybody.
Mary's one of my all-time faves. If you don't know her, you're going to absolutely love her. And if you do know her, you're welcome for this little treat. So as I run through a couple of quick announcements, drop your LinkedIn URL in the chat. At least drop in where you're coming from today, and we're going to blow through these. So round of applause for Ethico. We just got our accreditation for the Compliance Certification Board. So some changes are going to be coming on that front. It's taken us 2 years, hundreds of hours of content, and the Compliance Certification Board finally gave us our accreditation. So round of applause for Joa, all his the yeoman's work it's taken to get that accreditation. So stay tuned on that. We're going to be giving away today the FCPA Survival Guide. So if you have not checked that out, I would tell you to go ahead and do it. It's a pretty good overview of FCPA in general. And so with all the changes going in and out and up and down with FCPA, this is not going away anytime soon, despite what you may have read earlier in the year. So check that out for the most active folks in the chat. We're going to be giving those away. Of course, you can pick any book from the Ethico library. Also, we put a really cool toolkit together. In case you haven't noticed, we are back on our toolkit game. So we've ripped out several toolkits this last year, the most recent of which was the Compliance Week toolkit. So definitely download that if you haven't checked it out. But the Disclosure Reports toolkit has everything you need, a bunch of great resources there for you. And I wanted to share our some of the changes that we've made with our case management system. So you should be able to see that now on your screen. We've revamped the entire user interface to give you better access to the information you need to make better bets with your time. Our automated workflows module just came out as well. So there are this is like a blank canvas. There are myriad use cases for this to help you build in to your process the process adherence that you work so hard on. So it also helps to really keep your data cleaner on the back end. So if you're interested in hearing about how you can leverage that, if you're using the Ethico case management platform, reach out to your client success manager or drop something in the chat here or go ahead and book a demo and you can see how that might build some more leverage for you. We have our risk intelligence package as we round out the year here, 25% off. And what this risk intelligence solution set gives you is access to several of the modules that can work in concert to achieve the ends that you might be looking for. So everybody's at a different stage in their compliance journey. And the name of the game is not finding some silver bullet that's going to fix everything, but rather it's to build a resilient, sustainable program that can flex as the changes of your business happen and as new regulations and so forth come out. With that, I want to get one more massive explosion of emojis and emotions for Mary. She runs Whistleblower Partners. Whistleblower Partners is the preeminent whistleblower representative out there. She's so many people I've met have been from Mary. She knows everybody. She has so many great stories, and she's right at the cutting edge of this whole thing. So, Mary, welcome back to the Ethicsverse. So glad that you're here.
Thank you for having me.
All right, so we're talking, this is one of our special healthcare episodes. There's been, in our pre-show, we were talking a lot about all the changes that have happened over the last year in the pools that you swim in. But I want to kind of zoom out of that a little bit and just kind of talk about whistleblowing in the healthcare landscape. Like, who are the traditional whistleblowers in the healthcare space?
Yeah, so they come from everywhere. They're typically insiders, and it's really interesting. Like you have everything from coding fraud to billing fraud. It really runs the gamut. But what we've seen recently is an expansion of who can be a whistleblower. So the False Claims Act, which is the primary statute for healthcare fraud, has very strict requirements. If to bring a case, you actually don't just file a tip, but you actually launch a lawsuit in the name of the government. So you have to plead fraud with specificity, there's a lot of pleading requirements and other things. So you can't just come in with a tip. It actually has to be fully baked. You have to have actual false claims to the government. You have to show knowledge by the target. So those are very strong standards that kind of preclude who could be a whistleblower, not just anyone. So it's really typically led to the prototypical whistleblower being an insider, because then they have all the inside information that this wasn't just negligence, that whatever the fraud on the Medicare or Medicaid or TRICARE program was, it was done intentionally with knowledge. But what's been interesting to observe is we're starting to see the rise of whistleblower outsiders in two different ways. One is competitors. We've actually seen competitors bring successful False Claims Act cases. And you can imagine, though, that they're not fully objective or removed from the space. They can see what's going on with their competitors and can sense more than the government can, unless they're auditing, that something's amiss. So one of the most famous cases is one of Sanofi Aventis, pharmaceutical company, who itself has been the target of False Claims Act cases, actually switching gears and becoming a whistleblower, and a successful whistleblower, and helping DOJ bring a $465 million settlement against its competitor Mylan for pricing on the EpiPen drug. So that is, I think, something that your audience would be interested in. I think we're all focused internally on how do we listen to internal reports so we can prevent someone from going external to the government. Well, you can't necessarily prevent your competitor from doing that. So that was a really interesting case, and presumably Sanofi just saw that the pricing and how they were characterizing the EpiPen as a generic drug in order to get a rebate. They must have seen something in sort of the cost data that I don't know. I didn't represent that whistleblower, but my suspicion is that's the kind of information that allowed them to pull on a thread and get it to the government and to succeed in fairly major style. Before I pause there, I just want to say the other type of outsider whistleblower that we're seeing is data analysts. So Medicare makes a lot of their data, their claims data, public. And so there have been a lot of firms, biomedical data people who have been scrubbing that data to try and find patterns of, maybe prescribing or diagnosing certain conditions that are highly reimbursed by Medicare at a level that far exceeds the prevalence rate. So you can see how that would work. That is difficult, though, remember, because you can't just, under the False Claims Act, you can't just give them data of this looks suspicious. It has to be actually specific with knowledge. And so what we've seen is some groups hiring private investigators. So they're going outside, they're looking for suspect patterns, and then they're hiring private investigators to look for former employees and other folks to give that additional piece of data that would allow them to file False Claims Act cases. So that's a whole new game, right, in my view. So I think to your audience, the risks are coming not just from the inside, but from competitors and some entrepreneurial data analysis firms.
So what tips would you have for me if I was trying to get my competitors in trouble with the government? Just kidding. I'm kidding. Okay. But so what do we do with that information, right? Like, it's not just an insider that we have to, defend against, so to speak, or try to anticipate. It's now this other category where, I guess you could argue that people are trying to, game that system a little bit. What do you think someone does with that information, or, how do we handle this like new emergent, tangent really that we could be attacked on?
Yeah, I think one way is to, leverage the same tools that they're leveraging in order to make sure that you've got early warning systems in place yourself. So very much on the point of whistleblower insiders, making sure, and we've talked about this before, that you actually are creating a space where those insiders want to report to you first. I can tell you there's the data, if I were talking to the C-suite about why we would need to invest in really good internal reporting systems and training on how to listen up when people speak up, all those sorts of things, the data is overwhelming. And what I would love to get in front of C-suite folks is some of the social behavioral science, but also research, including new research. I always talk about some of the old research, but today there's some breaking research that I want to talk about. So first on the old research, there's two professors out of GWU and University of Utah who took Navex Global's data set and basically scrubbed it and analyzed it and said companies who have internal reporting mechanisms that are ringing off the hook, that are very effective, are actually more profitable than companies that don't. So we've cited that research. That's Kyle Welch and Stephen Steubens. It was in the Harvard Business Review, really important stuff. But what we've seen recently is data that I'm actually breaking this news today in terms of research coming out of Boston University that talks about how effective whistleblowers are for the government. So I think in talking to the C-suite, I would say, why do all of these government agencies pay whistleblowers so much money, right? It must be because they're incredibly effective. So why are we looking at them differently, not as this sort of risk management tool, but instead as, an internal disloyal villain? Like the data just doesn't bear that out.
Doesn't support it, right?
Yeah, and so the research coming out of Boston University was really interesting. They said that whistleblowers save taxpayers billions of dollars. So it's a 10-to-1 deterrence effect. The professor is Jetson Letter Lewis. And he basically said that $1.9 billion in False Claims Act settlement payments have generated $19 billion in Medicare cost savings. So what he did is he went and he looked at DOJ data. So you can imagine in a billing fraud case, how he made that analysis is he said, this is the money that was saved by the Medicare program by doing and taking an enforcement action, stopping the behavior so that the billing didn't continue. So that's how he was sort of able to calculate the deterrence effect. But I think that's directly relevant to companies. Like it's the same principle. If you let them be the deterrent, they're going to not only like stop and save you money from then retrospectively, but also prospectively. So I think that's some really interesting data to look at. There's also some really interesting data, again, breaking news, a professor out of Ireland, her name's Professor Kate Kenny. She's written many books. She's at the University of Galway about whistleblowing. She's done a study with Transparency International, just released her findings a couple weeks ago about the role of gender and intersectionality in whistleblowing, which I think is also fascinating, that I would encourage your audience to think about when they're encountering whistleblowers of whatever stripe, internal whistleblowers. Some research that they've seen coming out of Europe that confirms what we've also seen in the US is that women, it's 50% of women who blew the whistle face retaliation as compared to 37% of men. So
Interesting.
A pattern that we're seeing, that women face the effects of retaliation more strongly. And because of a lot of these issues, they're less likely to speak up or speak up individually, and would be more likely to speak up in groups. So there's some data there, but I think mostly.
So what do we do with that? I mean, I'm not super shocked by that. Like that's probably in the direction that I would have bet, but how do we leverage that? Like how does somebody who's listening to all this breaking news, who is maybe vibing with what we're saying, but they still feel like it's kind of that old world kind of vibe around whistleblowers inside their company. Like, how do we actually take some action and leverage that, do you think?
Yeah, I mean, my sense is that it depends on your leaders. Like, who are you trying to persuade that we need to have a cultural change or a structural shift that really takes into account that we need to create an environment where whistleblowers feel safe to speak up and to be that early warning system. It depends on how they are motivated, but that's why I always do the Welch and Steuben study, because everyone's motivated by money, right? That it's not just the right thing to do, right? To create a workforce and a place where people feel that they can do the right thing and be not retaliated against for it, but instead applauded for it. But it's one thing to say that's the right thing to do. It's a totally another thing to say it actually makes money for you. And so that's where I feel like both the data coming out of Steuben's and Welch, but their research, but also just looking at, this is what I hadn't thought of until this morning in my first cup of coffee. Just look at, do you need any more evidence of the fact that the United States government over the past 15 years has been expanding whistleblower programs to encourage them to provide tips? That tells you, and to pay them, enormous amounts of money as a finder's fee. Like, you wouldn't do that unless whistleblowers were your secret weapon in rooting out wrongdoing. So if you want to stop fraud, and we're seeing why the deterrent effect matters, then you need to take them really seriously. And I keep staying at that level because I feel like that's the thing that hasn't gotten through to a lot of these C-suite people. Is I think as soon as you say the word whistleblower, I think there's like, yeah, we'll have a tick box exercise. We've got an internal reporting system. That isn't that good enough. And I think the risks keep getting higher. So I think that's the other piece the other takeaway that we had. It's not just insiders anymore. Now we've got supercharged data analysts, supercharged by AI, who are doing that. So I think, getting back to your other point, what should you be doing? You should also be taking advantage of how AI can help you distill your data to be finding these suspect patterns before, because if you're not finding them and correcting them, we now have a government division in CMS in Baltimore that does nothing but this, and then incentivized whistleblower outside data analysis firms that are paired up with doctors and physicians who can take that data and figure it out, that are incentivized to do that. So I think your risks have become higher. So hopefully that answers your question.
Yeah, there's just this ongoing sort of challenge in this space of like I call it the like, I don't know what I don't know risk. And it's almost kind of impossible to like satisfy that. Do you know what I mean?
Yeah.
And so is the antidote, or is the approach really just, back to maybe a previous conversation we had, is it really just trying to look for opportunities to improve just as an ongoing kind of model, and look for opportunities to, put that good faith effort into like building a truly effective program? Is that really just the game?
I think that's the game, because remember, as we just pointed out with women whistleblowers, like the risks of speaking up internally are still extraordinarily high. Because you face the type of retaliation. I mean, it doesn't matter what industry, the playbook that we see out of corporations is the same, that rather than onboarding the criticism and the potential problems and trying to correct it, we shoot the messenger. We start to make it about them. They're a disgruntled former employee, like they, are chronically late, or whatever pretextual reasons you want to gin up to say that they shouldn't be listened to. And then we like exit them out of stage left in any number of ways, in a pretextual reduction of force, whatever. And then we go about our business. And I think that the problem with that is such a missed opportunity, because the few people who have the intestinal fortitude to persist and speak up to you are the ones who are actually seeing something wrong and have synthesized the data. So if someone is actually sticking their head above the parapet inside your organization, you damn well better be listening. Right. And I think that it can be just as simple of a correction as just to not ignore these people and not ignore their findings, right? I think we get so obsessed with the profile of the person who's bringing you the information, and it should just 99% of our cases, the whistleblower never takes the stand. There's tons of other people to corroborate, right? They're just shining a light on something. It's rarely a he said, she said scenario, right? if there's one takeaway today, it's that just try as best to ignore the motivation of this person or any of it. Just look at the data that they're bringing, and understand that it took a lot for them to bring it forward. And chances are there's a there.
Yeah, chances are they're not the only person who's seen this thing, and chances are it's not some nefarious thing to try to get a couple bucks out of the company. It's probably, to your point, that sort of expression of their intestinal fortitude and the dissonance that they have with seeing something that's, not the way it's supposed to be.
Yeah.
So I want to talk a little bit kind of from a healthcare perspective. Like, what are these major types of fraud that are currently under DOJ scrutiny? I think there's been a lot of debate over this last year as the new administrations come in on what they value, what they don't value. I know there was a talk over the last week where there was a representative from DOJ at one of these conferences who was saying a bunch of things. And I think a bunch of people in the audience, a friend of mine was telling me, they were like, what the heck? Are we watching different movies here? So I know there's been a lot of debate around what's in bounds, what's out of bounds, and so forth. But from a healthcare standpoint, what's kind of under DOJ scrutiny at the moment?
Yeah, I mean, I think enforcement priorities always change from administration to administration, but one of the things that's pretty guaranteed is that no one tends to be pro Medicare fraud. So we don't like our Medicare and Medicaid programs to be bilked, and so that tends to be a fairly safe area where it's kind of partisanship agnostic. So we're certainly seeing that there's still emphasis in trying to root out healthcare fraud. In terms of the patterns and sort of the trends and enforcement priorities, DOJ is very data driven. And as people on this call know, Medicare is broken down into 4 parts, A, B, C, and D. Part C, which is the managed care component, sort of the HMO-ification of Medicare, that is running pace that is almost close to over 60% of all Medicare beneficiaries are choosing to enroll in these HMO style Medicare Advantage plans. So that means that's where the emphasis is, right? That the government is going to put their enforcement and resources in the area where most of their Medicare beneficiaries are. So I'm going to focus my conversation mostly today on what we're seeing in Part C. I've been very fortunate to, and this feels like Schadenfreude in terms of fortunate, that about 15 years ago, I worked on one of the first risk adjustment fraud cases, and it's become an industry-wide fraud. So we started with a $37 million case on behalf of a whistleblower against Freedom Health, won a health insurance plan, and then have gone on to represent whistleblowers at Kaiser, at Sutter, at United Health Group, at Independent Health. And many of those have settled. And so it is one of those rare things that can happen for a lawyer where you get in early and then you see that not only is this one defendant doing it, everyone appears to be engaged in this practice. And so just to describe it really quickly, and it's hard to put it in a nutshell, but it's basically increasing the severity levels of illness of Medicare patients to make them look sicker than they are in order to get increased reimbursement. So Medicare Advantage, Part C of Medicare, HMO, has actuarial analysis where they pay the health insurance plan one set amount, regardless of how many treatments they're given. And so it's usually an actuarial analysis, 70-year-old woman in Miami, we're going to pay you X amount to insure her. But if she has a bunch of comorbidities, if she's particularly sick, then we'll put a multiplier on that. So lo and behold, what we've seen is a lot of allegations brought by many of my clients that are saying there have been ways that these health insurance plans, but also provider groups, physician groups, and also vendors, which I want to talk about today in terms of the risk that vendors play in this business, is to do things like one-way chart reviews. So going back through a patient's charts long after the doctors have seen them to mine them for codes that might increase their risk scores. And so there's actually a lot of empirical data coming out of the Kaiser Family Foundation HHS-OIG, showing that when we look at chart review processes, that the health insurers are much more likely to pick up a code than ever to remove one. So that's what we're talking about.
Which kind of speaks to the one-way thing.
Yeah. And this is where I want to put a big asterisk on underscoring the role of vendors here. Is we just had a settlement last year, exactly this time, on behalf of a whistleblower named Teresa Ross, a close to $100 million settlement with Independent Health, a health insurance plan in upstate New York, who had a vendor called DXID. They don't exist anymore. And their CEO, a woman named Betsy Gaffney, they had been reimbursed based on for their vendor services based on a contingency fee model, which is frowned upon because it creates perverse incentives. And they basically were mining for these codes inappropriately and being incredibly aggressive in pulling down codes that were not substantiated during a face-to-face visit in the year of the encounter, which is what the rules require. So I just point that out because I remember trolling the conference circuit for clients years ago, and seeing vendors like Leprechaun, who was promising gold at the end of the rainbow, right? That you can, I think these and that was the thread that ran through this case, is this was the second settlement in our case because our whistleblower came out of now a Kaiser-owned entity health plan called Group Health Cooperative. And the settlement there was exclusively related to the work that this vendor did for Group Health Cooperative and sort of crossing the line into very aggressive practices. So I have to brag. This case was featured on John Oliver's Last Week Tonight last month. I don't often have that kind of stuff to point to. And the section, so he was doing a segment. He's very suspicious of Medicare Advantage plans and the kind of the quality of the care that you actually get under them, and was kind of underlaying. It was open enrollment period, and he was wanting to educate people about maybe you should consider traditional Medicare and not go with these plans. And one of the exhibit A's he gave was like, and oh, by the way, they've been sued for lots of egregious practices. And then he did a segment pulling a paragraph out of the government's complaint in this case that I said. And wow. the vendor had created a policy where they said when there are married couples, you should code in such a way that both of the members of the couple have the same conditions, including a woman being coded for prostate cancer.
Sure. With no exception. With no exception, that's our policy.
So he did this lovely scene of a husband and wife saying, doing their vows, in sickness and in health, we'll take each other's. Prostate
cancer. Yeah, exactly.
Yeah, exactly. So that's one.
Should we watch the clip?
Oh, I'd love to watch.
Let's watch the clip. All right. That's a crowning achievement. That's very good.
I have to tell you that it's not very often that I can explain my work to my children, and they're 19 and 23, and that was the first time.
That's great. So how does that whistleblower process happen, right? Like, you found this same problem across a bunch of different folks. It seems like it's kind of a common practice.
Yeah.
You said it's not sort of that common for an attorney to be in that kind of a situation where they're able to see kind of multiple dominoes fall. So how does that process work? And how are you able to uncover it? Or how could somebody obviously listening to this take steps to make sure that they don't find themselves in a similar situation?
Yeah, I think it starts, especially with the independent health case, with really doing due diligence on your vendors. So be careful of things that sound too good to be true. So in this case, the CFO of Group Health Cooperative was at a conference, and I think it was the CFO of Independent Health, where the DXID, the vendor was born out of that, rolled out of that. It was an internal unit and then rolled out of it, sort of singing the praises of the returns that you can get if you hire them, and that they're on a contingency fee basis. And so the CFO brings this back and tells our whistleblower, who was the head of Medicare reimbursement, and she was like, well, I'm the expert here. I'm happy to look at these, but, we've been doing a lot of this analysis ourselves. And lo and behold, the way they got these kinds of returns for people was being overly aggressive. So first of all, don't, hire vendors without talking to your internal people. So that I'm sure that could have been nipped in the bud if the CFO had brought it back to his subject matter expert and said, what do you think about this? But it was a fait accompli. It was brought to her and said, you're working with them. And then as she worked with them, she saw how aggressive those policies were. We just saw from John Oliver. And she, even though people were, and this is a really telling fact, even though people internally around her were grumbling and saying, agreeing with her that this was improper, when the CFO and leadership said, no, double down, we're still going to do this, she refused to sign the government paperwork that said those codes were accurate, because she could, obviously it's her reputation. And that's when she became the whistleblower and was forced out. So,
was her whistleblowing in response to being forced out?
So her was
kind of
yes,
happened?
yes. So when she was forced out, she then went to an employment attorney who said, yeah, you probably have a retaliation case, but probably what is more important here is that you've got a False Claims Act case. And so that's sort of how she came to us. But there's one other thing I want to say that's a trend that is just really alarming. And to me, this is for your audience of when you think you have the best intentions and you're like, oh, no, we listen to whistleblowers. The way retaliation can happen and can be so insidious is what happened to Teresa, my client at Independent Health. At Group Health Cooperative. And then another client of mine said the same thing happened to them, is when she refused to sign that attestation, they had, remember it's a healthcare organization, they had a psychologist come and evaluate her. So talk about gaslighting, right?
Totally.
There's something wrong with you.
What's wrong with you? Yeah, yes. There's something wrong with you. Yeah.
So
that's crazy.
And that's the sort of stuff that happened at, a reputable organization. Totally. And that's, again, just sort of this, like, why can't you get along? Everyone else has gotten on board. So you weren't capturing all those grumblings that were percolating. No one else stuck their hand in the air. And it really came down to Teresa when the rubber met the road and she had to sign her name to something that was, she would be perjuring herself to the Medicare program that sort of created it. So it's a very chilling tale. So look at vendors very closely, listen to your subject matter experts, and pay attention to sort of these trends for ROI that are just too good to be true. Right?
Totally.
If it's too good to be true. And that's why risk adjustment is so powerful, is you can it's one of those levers, and it's very telling that Group Health Cooperative was on the ropes financially. They'd had really bad quarters and they were really needing to sort of turn their ship around. And the lever they could pull very quickly was adding these inappropriate diagnosis codes and to get their numbers up fast.
Right.
And those are the kind of areas where you just have to be particularly vigilant.
I'm just trying to think about it from the standpoint of the compliance officer at either of these companies that you're talking about. I would just want to assume, and I think it's probably like a decent bet, that they probably didn't know about it. They probably would have been horrified to hear that, someone who's over something as, I don't know, like important as like the billing thing was not willing to like sign their name on it. Like that's a very clear sort of violation of the sort of culture of integrity that they would presumably be espousing, right? Like there was some blind spot there.
It came from the top, right? Came from the CFO.
Yeah, well, right.
And that's obviously where compliance has to come in, but it's
Well, yeah, I'm just saying from that compliance person, like just assuming positive intent of that compliance person who was at that organization, they must have been like, what the heck? Like, I would not have I wouldn't have stood for this. So, like, what do we do with those presumable, like, I don't know what I don't know type things? Like, what do we do to address those inevitable blind spots, which is a massive one? I mean, $100 million is a massive number. They have
Yeah.
presumably, again, had somebody in there to try to prevent, risky behavior from happening. I get that this is kind of a perfect storm, but it's always a perfect storm, when you're cleaning up,
Well,
afterwards.
and a perfect storm across the industry. Right,
Yeah,
that's the
right,
thing, and
right.
you could maybe excuse independent health and group health cooperative because it was early days. We're now on the cusp of. It looks like we represent one of the Kaiser. There are multiple. Well, this is interesting. Let's shift to. So my point is that now that we're in a stage where I've probably spoken over the past 15 years at like 30 conferences on this topic, right?
Hmm.
Is that it's now that this is an enforcement priority and you're reading all the settlements that have been achieved in this
Right,
space, like it becomes more and more dangerous, right? And more egregious. Was when I started in
right.
this space, DOJ didn't have a special unit in Maine Justice where they look at these cases. They'd never heard of this kind of fraud before. So, and I think some of those earlier cases probably settled for far less than they would now because now the government understands the
That's
practices and
known.
permutations, right? That's all to say you need to be doing what you should be doing as compliance officers, always watching the enforcement trends and listening to the priorities. And here, there were a lot of HHS OIG reports that talked about the amount of money and the fact that it was so much more expensive for care under Part C, and that there was a sense that they were overcoding. There were a lot of HHS OIG reports on this topic. So,
So anybody who's kind of reading the tea leaves was probably not surprised by this, by tuning into that stuff, is kind of the point.
yeah, and one thing I'll say for your listeners is that as Medicare Advantage plans have sort of receding and shrinking into the distance a bit, we've seen a lot of that in the news. My view is that this same practice will move over to the affordable care, the Affordable Care Act (ACOs). These practices have a way of moving, and there's much less government oversight in the ACO space. So my sense is practice isn't going away; it's just shifting over to a different area. So you can be sure that that's an area I'm out there trolling for whistleblower clients on right now. So you can just follow me and see where I'm headed right now.
Just make sure she's not talking to any of your people.
That's right.
So what are some of the, like, what are some early warning signs that a compliance person in a healthcare organization might be looking for to see if that's a rock that they should look under? I'm talking about, like, legitimate coding accuracy initiatives or these kind of fraudulent coding schemes. Is it merely, hey, the environment's changing, or like we've had a couple of bad quarters, so the circumstances for sort of bad acting is like higher, and I just need to be on guard for it? Are there certain, data relationships that might be good kind of early indicators?
Yeah, I mean, I think that one of the things that CMS looks at and these data miners look at is just like, where do we sit vis-a-vis prevalence rates? So some of the, there is a type of severe malnutrition that you really don't see outside of sub-Saharan Africa. So but it gets a risk adjustment multiplier, gets more Medicare reimbursement. And for a number of these plans that we were talking about, you would see like the coding of that particular diagnosis, like off the charts.
Yeah, everyone's going to sub-Saharan Africa. They're picking it up over there.
Yeah, I mean, that was before GLP-1, so we didn't have as much of a. I'm not trying to in any way talk about like food insecurity. We obviously have a lot of people with food insecurity, but we just don't. We weren't that kind of malnutrition. We weren't seeing in the rates, or shouldn't be, and mostly the prevalence rates were not bearing it out. So I wasn't trying to make light of that. It's just that those are obvious trends, right, that you should be able to see if that's what your providers are doing. And now with AI, I think in the way you can like get your data sliced and diced faster, I think you have metrics to sort of look at that sort of stuff. But it tells you where to look, right? We know this is a vulnerable area. Risk adjustment is a vulnerable area. So that's obviously a place you should be looking. The other place that we haven't talked about that I did want to discuss is kickbacks. So under traditional Medicare Parts A and B, some of the biggest prosecutions that we have seen over the past 20 years coming out of DOJ have always been kickback cases. And what I wanted your audience to know is that we're now seeing that move over to Part C. So, so into managed care. And how we've seen it is there have been 3 settlements recently, and then a newly intervened case, and also a fraud alert, all in this area. So that's obviously a place that you'd want to be looking. So if you haven't thought about your kickbacks, you need to do that. So here's what we've been seeing in Part C. In Part C, the game, as you saw from John Oliver, is during the enrollment period, you want to get the healthiest patients to your plan. You don't want the sick ones. You make a lot more money if you don't have the sick patients. And so there were 2 cases out of the District of Puerto Rico, I think a $4 million and $15 million settlement, where the kickback was super simple, where health insurers were giving gift cards to the administrators inside doctors' offices to steer patients towards their plan. So that's obviously pretty basic and should be able to be detected. But what we saw just a few months ago, I think it was in May of 2025, DOJ intervened in a whistleblower case. It's called U.S. ex rel. Shea against eHealth. And it is not just small plans like we saw out of the District of Puerto Rico, but instead cases against 3 of the largest health insurers. So it was Aetna, Elevance, which was formerly Anthem, and Humana, are all defendants, plus 3 of the largest insurance broker organizations for this very same process, where they were trying to pay kickbacks to those insurance brokers to get them to enroll Medicare beneficiaries. So, but one of the practices going on is so much more egregious, which was also, so that's a practice known as cherry picking. But what also went on in this case is lemon dropping. So they were actually paying people to get rid of the sickest patients, so people with disabilities. And obviously that's an incredibly odious practice, and one that DOJ will not like. So those allegations are there. So there's a huge emphasis in this area. And another place where we've seen it, there was a settlement, Oak Street Health paid $60 million, and they're what's called a capitated provider group. So the prior cases I was just telling you were the targets were health insurance plans. This settlement was achieved by a provider group, which was engaging and paying kickbacks. Similarly, had to pay $60 million to the government. And the reason how it impacted Part C, a managed care case, is because those provider groups have an incentive with the health insurance plans. Are called capitated arrangements, where they get a piece of the profits that the health plan gets. So they have an incentive to only, treat the healthier patients. So that's just another area that I think people should be very cognizant of. And so and remember, kickbacks come in all sorts of forms. It's not just gift cards. There can be payments of making arrangements for providers. We've seen a lot of payments to doctors where the doctors will get special dispensation in the form of rent in their office spaces, things like that they use as a kickback, as an inducement to try and get doctors to engage in certain behavior. So it's not always the most obvious. So you really need to look at how the compensation streams come in any sort of quid pro quo.
I was going to ask you about like that lemon drop thing. Were you surprised to see that creep into the C program?
No, it was actually one of my first cases before I figured out it was a risk adjustment fraud case. It was one of paying brokers to take the sickest patients and get them off their plan. So I had seen the whistleblower came to me. Yeah, the whistleblower came to me with lists that they had generated. So the health plan had generated the list of the people on their plans who cost them the most money, and handed that list, the list of lemons, over to the broker, and then paid the broker a bonus every time they got one of those people off of their plan and onto somebody else's. So
yeah, so I guess in that case, they're like, I don't care where you put them, just not here type of. Yeah.
And that was what took my whistleblower, who was very vulnerable, to say, like, it just tipped him over the edge. He'd been quietly sitting and watching other things happen. And he was like, that could be my grandma. That could be my 90-year-old grandma just got moved off my plan and lost all of her doctors. And just like, it just outraged him to such a degree. Yeah.
I want to talk a little bit about the new DOJ antitrust whistleblower program as we're getting to kind of close to the end here. I was wondering, like, what perspective you have on like the gap that this antitrust whistleblower program fills in existing whistleblower protections.
I love to talk about this program for a number of reasons, because it came out during the Trump administration. So I think there's a perception that Trump is anti-whistleblower, and that we wouldn't see any new whistleblower programs on his watch, even though we've seen them consistently come online, every year, every other year. So to me, it's really notable that it happened on his watch. And it also closes a gap where it's in one of the few places where we have been behind. The United States has been behind Europe and other countries around the globe. So even though the U.S. has been a leader in paying rewards to whistleblowers, one of the few spaces where Europe and other African and Asian countries have actually decided that rewards are needed is in the antitrust space, the cartel space, the bid rigging, price fixing space. And it makes a ton of sense, right? Because how are you going to it makes a ton of sense for two reasons. How are you going to detect bid rigging or price fixing without insiders, right? We all know from the movie The Insider with Matt Damon, these kinds of conspiracies to rig prices happen in smoke-filled rooms where nobody's writing anything down and everyone from the industry is conspiring. So it's very hard to detect that kind of fraud from the outside. And the other piece is that it's also so much more dangerous for a whistleblower to speak up in this space. So you absolutely need to incentivize them. Because think about like Teresa Ross in my health insurance case. Like, she obviously, harmed her career as it related to independent health and group health cooperative, but not necessarily to the whole industry at once, right? So it's not clear that like she might be blacklisted, but it wasn't like there was a discrete group of targets that she exposed.
Right.
When you're exposing a cartel, you've got everybody in the room, like everyone in that industry. And so if you become known as that person, you're literally in one swell swoop, sort of persona non grata. So it just felt like if there was ever a place where you needed a whistleblower reward program, it was very much in the antitrust space. So it's very exciting. We've caught up with our peers in Europe. It is the kind of case where we didn't get special legislation to bring this program online. So what the DOJ criminal had to do and the antitrust division did is they actually used their existing powers to pay confidential informants and sort of took powers that came out of the Postal Service. And so it is limited. It's not, whistleblowers can receive rewards if they're able to expose criminal antitrust behavior, and they can get 15 to 30% of any fine above $1 million. So it can't be minor,
Okay.
but it needs to be bigger. But it's still quite significant. And so we were very fortunate to have one of the first huge antitrust cases under the False Claims Act, which so it was a case against, it was a defense contractor. It was bid rigging by contractors in Korea who are supplying U.S. military bases with fuel. And so one of our whistleblower insider, his family member ran one of the oil companies, and he became aware of this information, cooperated with DOJ, and it was to the tune of like a $363 million settlement, and he received a sizable reward. But it was that kind of whistleblower cooperation that caused DOJ out of that case to create a strike force, a collusion strike force, and that has sort of been what has inspired the adoption of this program. So it's exciting. And so if you're in any concentrated industry where consolidated industries, which we're seeing more and more of, there's certainly a lot of opportunities for whistleblowers to speak up, and there's obviously a lot of risk associated with it now.
So if you were a compliance person in a healthcare organization hearing this information, what would you do with it? Is it start a new campaign inside your organization, try to address the potential probable sort of knowledge gap that exists there? Is it merely just like marketing, re-educating the workforce about the programs and the programs that are in place and the steps your organization is sort of in a good faith way taking to make sure that, you know, wrongdoing is rooted out? Are there other things that you might do? Like, what kind of action do you think somebody could take?
Yeah, I mean, I think what's so interesting here is, to my earlier point at the beginning, you know, there's this question of if you don't believe that whistleblowers are valuable, then the only proof you need to be dissuaded of that view is to see that literally every year another program comes online, and every year those risks for you increase. That if you ignore these people, they now have more and more incentives to go outside. And so we haven't even talked about the fact that DOJ now has a tip provision, and even under the Trump administration, they expanded, not contracted, the types of frauds that whistleblowers can bring. So I just feel like that it's really important that you be the kind of organization that encourages those people to come to you first, so that they don't bypass you altogether and go directly to all of these, to the loving hands of all of these external agencies who are fighting each other to get whistleblowers. I mean, DOJ, it was during the Biden administration that they came out with this corporate whistleblower award pilot program. But as I said, Trump expanded it, including to go after private healthcare fraud, which is really interesting. We haven't talked about that. And that's because they all know one common principle, which is that trying to fight fraud or wrongdoing or detecting, potential problems without the aid of a whistleblower is like, fighting fraud with one arm tied around your back. That they are the key to unlocking these problems. And so,
Right.
that, as you know, the stat I love to draw out comes out of the SEC program. And it's a very sobering statistic, which is that they looked at all of the whistleblowers who had received financial incentives, basically got a reward from the SEC. So those are going to be the most successful whistleblowers. So that's a pretty good pool of high caliber whistleblowers. And typically around 80% of them all reported internally first. And that's definitely my experience, right? Which is that,
Totally.
Again, to me, I think the most important thing that people need is to change the perception of whistleblowers, the myth inside their organizations that these people are disloyal and are people who need to be exited immediately, and just turn it on its head to show what the data shows is that they're your best risk management tool. And I don't think you need a lot of fancy, I mean, you need a lot of training and a lot of hard cultural work to get people to feel safe enough to do that.
Yeah, but you got to start by talking about it, to that exact point. It's almost a certain arrogance to be like against a whistleblower,
Yes.
Like,
but
how dare you even imply that anything is wrong at this company? You're disloyal. I mean, it's why it's such a wild, it's just a wild attitude.
And this is the defensive crouch that we get in. And I think that's where training needs to come, where, of course, anytime someone criticizes you, it's a case for improvement, right? It's a learning opportunity. If you have a growth mindset, all of those sorts of things. But our human instinct is to get defensive and to find a way to fire back at the person who, quote unquote, criticized you. And of course, not all whistleblowers are trained to be diplomatic in how they do this.
Well, yeah, in many cases, it's just a reaction in a way.
Right. And that's why if you can take the emotion out of it and move the whistleblower off to the side, like there's such a temptation to look at all of their motivations.
Totally.
It's really a red herring. Get over to what is it they're talking about? And what evidence do they have, and who can I talk to see if I can corroborate it?
So I did have a question about evidence, but I also wanted to talk about that expansion that, to your point, we didn't get a chance to talk about, the expansion into private fraud. You want to talk about that for a couple minutes?
Yeah. So under the Biden administration, the Justice Department, again, they didn't get legislation to allow bringing in a new whistleblower program. So they use their existing powers to pay confidential informants. And for the DOJ program, that came from forfeiture. So if a whistleblower can help you find the proceeds of crime, you can get paid a percentage of that. So it's very limited. It's not, and it would be great if this could get expanded and Congress would give us a full program. I don't see that happening anytime soon. So it's limited, but one of the areas that it was a gap filling measure. So people will appreciate that what DOJ said is that we have all these existing other programs, but there's some really huge gaping holes where DOJ is not getting information. So one of the places where there was a gaping hole was under the Foreign Corrupt Practices Act. If a whistleblower had information about an FCPA violation at a private, not publicly listed company, they didn't have a method to get a reward. So a lot of that information was just sitting, and I experienced that myself. We weren't able to bring that information forward. So they included, the ability for FCPA violations in this new program. But the other gap they sought to close was recognizing that there's a lot of fraud, a lot of these billing frauds that actually affect private insurers and private healthcare, not just Medicare government health insurance programs. And so we want to encourage people, because that has the negative effect on many of us of increasing our premiums and other things, right? That has a negative effect to people. So California and Illinois have had these kinds of insurance fraud whistleblower programs in their states. And so DOJ looked at those models and said, we should have that too. So now whistleblowers can, when they have examples of private healthcare fraud, can bring those kind of cases too.
Well, we have about 1 minute left. Let's get a massive round of applause for Mary. Mary, every time you come, you are just phenomenal. Almost 5,000 emojis on a Tuesday is wild. Okay, so that's really good. Maybe people are cold or something, but really, thank you so much for coming. Really great insights, really phenomenal as always. Find Mary on LinkedIn. And I guess if you have any whistleblowers that you can't handle, send them on over Mary's way. You know what I mean?
Sounds good. Thanks so much, Nick. Appreciate you, Joa, the whole team.
Absolutely. We'll see you guys Thursday. We have a great session about AI guardrails, and we're going to be doing a deep dive on implementation roadmaps and governance frameworks. You do not want to miss it. Love you all. Have a wonderful day, and we'll see you Thursday.